This is a non-toxic, short-course therapy which for long periods of time prevents the rejection of a transplanted organ, and that has not ever been done previous to this report.
If this ultimately works in humans, it will, I believe, totally revolutionize the field of transplantation.
With Dan Rather reporting from CBS News headquarters in New York.
Good evening. Correspondent John Roberts explains how this works.
Since Gary MacDonald received a heart transplant almost 10 years ago, he's had to take a powerful combination of drugs to prevent his immune system from rejecting the organ. Drugs that can cause serious side effects.
I've taken an awful lot of medication over the years, and I'd be very happy not to have to take it anymore.
Today's announcement by doctors from the Naval Medical Research Institute may mean patients like Gary MacDonald won't have to take those drugs for the rest of their lives. In experiments with rhesus monkeys, they used 2 new drugs that taught the animals' immune systems to live with transplanted kidneys.
These treatments have involved a single intravenous injection to which there have been no side effects.
When an organ is transplanted, the immune system signals that it has found a foreign body, then sends a command to attack the organ. These new drugs block that attack signal. Columbia Presbyterian Dr. Eric Rose says if it works in humans, it could be a major breakthrough.
It'd be heaven. That's what we're trying to do. That's the basis of all transplantation science at this point.
There's 2 other implications from this research. The kidneys transplanted into the monkeys were far from a perfect match, meaning patients could have a wider choice of organs. And if the number of patients who reject their organs and require a second transplant could be lowered, it would take some of the pressure off waiting lists. Dan?
Thanks, John.
In the study out today, doctors at U.S. Navy laboratories successfully test an entirely new type of anti-rejection drug in monkeys. Patients now must usually take anti-rejection drugs for life, and the drugs often cause harsh side effects. The new drugs are given only for a few weeks after the transplant, and they have few side effects.
This is a non-toxic, short-course therapy which for long periods of time prevents the rejection of a transplanted organ, and that has not ever been done previous to this report.
The drugs grew from a new understanding of how certain white blood cells, called T cells, attack and destroy transplanted organs in the same way they destroy disease-causing organisms. The drugs act like a switch that turns off the T cell attack on the transplanted organ, but the drugs do not disrupt the body's normal immune response against disease.
The specificity of this is a goal that immunologists have searched for ever since transplantation has begun.
Jill McMaster, who needs a kidney, is one of the more than 50,000 Americans awaiting a transplant.
I'm optimistic. It may not help me, but it certainly will help others.
The first human tests of the new drugs should begin in about a year. If they prove effective, the drug should become routine in about 5 years, beginning a new era of transplant medicine. Robert Bazell, NBC News, New York.
When we come back,